All right, guys, let's talk about Down syndrome. This is one of our pediatric pathologies that's going to show up in the neuro section. So it's going to affect chromosome 21. So we'll get into detail about how it affects chromosome 21, but it ends up there's 3 of them instead of just 2. Ligaments become super lax, so they're loosey-goosey, which is going to cause hypermobility at the joints. So understanding that it's the same kind of thing that we see with pregnant individuals with their ligaments getting super lax. Same thing is going to happen with these Down syndrome individuals. So super loosey-goosey ligaments causing problems with the joints. That's also going to alter our biomechanics of the joints. And our muscles for Down syndrome individuals are also going to be hypotonic. And so that means they're going to have low tone. So that means decreased force production from these muscles. And so we're going to get into that later about how I want to describe hypotonia. And then brain, the nervous system is affected, of course. We're going to have problems with development and developmental delays, as well as intellectual delays. So again, these individuals, they're not like stupid or anything like that. It's just their brain processes things in a different way. So the way we're going to have to approach treatments can be slightly different. And another thing I want to talk about with individuals who have Down syndrome is they're going to have problems with their cardiovascular system, which is going to either result in congenital heart defects, or it's going to result in some sort of malformation of the cardiovascular system in general, which is one of the reasons why individuals with Down syndrome do not live as long as individuals in the rest of the population. They have got the age up to like mid-60s and stuff like that. But again, it's going to be a shorter lifespan due to problems with the heart, and then also the sedentary lifestyle, which can lead to obesity. And that definitely has a whole other set of problems all by itself. So etiology of this is we end up with an extra copy of chromosome 21. We either have it where it ends up in the wrong section. So as everything's splitting around and the, meiosis is happening and stuff like that, one of the chromosomes says, I'm a go to the other side. So that's what's happening in translocation, non-disjunction. One of the cells ends up with 3. The other one ends up with 1 at the end of the day. And the one with the 3 continues on. The one with the 1 dies. So again, the cells can handle the 3 chromosomes. They cannot handle just having 1 by itself. So that's why individuals with Down syndrome end up having the 3 copies. That's pretty much it at the end of the day. Just they end up with 3. And then it could result in mosaicism. So translocation, non-disjunction will happen during meiosis. So yeah, we're going back to Bio 101. So you know how we have our somatic cells, so that's like your body cells and stuff like that. And then you have your sex cells, so your sperm and egg cells. The sperm and egg cells is where meiosis happens. And so that's where you end up with the extra, set of them, the extra 3 or whatever. And during fertilization, that causes problems because there's just an extra one just floating around. It's like, whoa, okay. So yeah, that's what's going on. So that's what's happening. And so at the end of the day, you end up with a cell that should only have 1 copy to go with the others, like the sperm cell to go with the 1 copy of the other one from the egg. So like 1 from the egg, 1 from the sperm, but then all of a sudden, like maybe the sperm has an extra one or the egg has an extra one, then you end up with 3. And that's kind of what happens at the end of the day. So somehow you end up with 3 chromosomes for the fully formed fetus, and then it just keeps multiplying. Mosaicism is when, after the egg is already fertilized, some parts of the chromosome 21 like somehow duplicate, and then all of a sudden now you got 3 copies instead of just the 2. So that's post-fertilization. So actually a lot of individuals get diagnosed with Down syndrome like later in life. They have this mosaicism type of Down syndrome, and they only figure this out because they end up having a baby who has Down syndrome. And they're like, I'm like 24. Like, how did this happen? Like, doesn't this usually happen in older individuals and stuff like that? And blah, blah, blah. And they realize that from their own genetic testing that they actually had this mosaicism for Down syndrome. And it's kind of crazy. And they just went their whole life without knowing it. Wild. But anyways, some people who have that version of Down syndrome, it's more like prevalent in the facial features that we'll end up talking about. And then others, they just kind of go their whole life, and the only thing they notice is the simian line on their hand. And we'll talk about that in a moment. But again, the etiology of Down syndrome can be caused by increased maternal or paternal age. So I think the risk of Down syndrome, it like increases exponentially for every year after you turn 35. That's why they give you like an amniocentesis and stuff like that. especially if you're an older individual who's having a baby. I know they call it a geriatric pregnancy. So one of my coworkers, she was like, I can't believe they're calling me a geriatric. I'm like 38. This is rude. But that's why, because of the increased risk factors of having a child with Down syndrome. Environmental factors such as toxins can also cause Down syndrome. Viral infections of the mother can cause that problem with the like mosaicism as that around the time of fertilization that can cause the spontaneous addition of another chromosome, and then random dysfunction during meiosis. We kind of talked about that with the translocation, non-disjunction, and yeah, random mutations after fertilization for the mosaicism. What does it look like? So let's get into all of this. I will say saying MR, I'm not going to, if you want to look at it on YouTube and see what I'm talking about, that is no longer used in texts and everything. I just want to understand that that is going to indicate developmental and intellectual delays. I do want to point out some of the things in here, though. You're going to see a flattened back of the head, so you can't really see it in any of these, but if you look up a side profile of anybody with Down syndrome, this sounds bad. It's almost kind of like egg-shaped from the side, but you'll see that that flattened back of the head can cause problems with the child's ability to hold up the head correctly. So sometimes, and also it can cause problems with them to be able to sleep, and it can be made worse, especially right after birth. So what happens is sometimes they put a little helmet on these kiddos' head and they call it a day. I want to also note that their ears are going to be a little bit different. And then also we have some changes in the eyes. So if we look at this individual down here, if you want to look at this video, if you find the video format of this, either in the course or on YouTube. So you're going to see the almond shaped eyes. They have a large protruding tongue. They have a flattened like nasal bridge and everything like that. And they're going to also have this slanting kind of eye. So the eyes are going to be more of this slanted kind of thing. Another thing I want to point out is that the big thing that we have with Down syndrome individuals is we're going to have hypotonia. And so I described this as you come home from a long day in the clinic. You had your last patient was a pain in the butt. And like, let's say that you had a bunch of notes and you're just so happy to be back home. You eat your dinner, you sit down on the couch, you're like, okay, I'm going to watch like the next episode of whatever show you were watching. You sit down, you're watching it for a couple of minutes, and you're like, I'm so relaxed. Maybe you have a beer, who knows? Whatever you do at the end of the day, however you're relaxing, you're chilling, and then someone rings your doorbell and you're like, oh, I forgot I have to, so-and-so, my neighbor was going to bring me something today, and you're like, oh, I don't have to get up. So like the energy it takes you to like get up out of bed or out of your like seat and everything and get to the door, like that energy that you have to output through your muscles to get up because you're so dead, that is how it feels for an individual with Down syndrome just to get out of a regular chair. If they're like, I'm going to stand up, we're doing sit to stands, that's how hard it is. So that hypotonia results in individuals unable to produce the adequate force that normal people are able to exude to stand up and do exercises. So that's going to cause problems with maintaining stability of the joint, because if we lack strength, we might end up lacking some stability, or you might see that the individuals are going to have more joint pain due to the fact that the muscles aren't strong enough to pull pressure off the joint. You also are going to see that these individuals have a lot of ligamentous laxity. And so this ligamentous laxity, what that's going to do is that's going to cause instability at these joints, which can increase risks of dislocation. And so a lot of these problems we see in the hips, so you can see congenital hip problems, hip dysplasia and stuff like that, dislocating the hips, just lots of problems with the hips in general, and especially at the atlantoaxial joint. So we have atlantoaxial instability, and so that is where the DENS is articulating with the C1, the atlas. So our axis and atlas are articulating with each other. And so what happens is you have instability there, which could put pressure and excess strain along the alar and transverse ligaments. Those are the ones that make the plus to help stabilize the C2 on C1. And so if those aren't working and those rip, that results in internal decapitation. So we don't want that. So this puts the individual at risk for like somersaults. So that's why you don't want to have them do somersaults or anything, because they could literally decapitate themselves. So don't do that. Facial changes we're going to see with these individuals, as I kind of mentioned before, we got the almond eyes, the flattened nasal bridge, the abnormal ear shaped. We have the large tongue. The tongue is abnormally large, which causes it to protrude in a lot of these individuals. You're also going to see all the musculoskeletal issues due to hypotonia. So all of our, joint problems and whatnot, increased risk of osteoarthritis, and then the flattened head, as I said before. They're more prone to these cardiovascular diseases and obesity. And these are also due to like the connective tissue disorders from ligamentous laxity and sedentary lifestyle due to hypotonia. So again, they have some connective tissue disorders affecting the cardiovascular system, all the ligamentous laxity. Well, that's more in the musculoskeletal system. That's just another thing. And so like the same thing that's going to cause ligamentous laxity is going to cause problems with our other connective tissues in the body. So that's what I mean by this sentence. And then more sedentary lifestyle due to hypotonia. Again, like how many times do you want to stand up if you feel like you're like super relaxed every time you sit down? You're not going to want to move yet. And then they'll have this simian crease on their hand. And so that's where there is a crease that goes all the way across their entire hand. It's like just that like big one crease that happens that covers the whole hand. And it's like it's like most people have like the two creases on their hand, like the one that goes up and then the one that goes down. This one is just one straight across. And there's a girl on TikTok, she realized she had the mosaicism because she had the simian crease all the way across her hand. And then she got tested and they were like, oh yeah, you have Down syndrome. And she's like, well, whoa, that's crazy. So yeah, that's what's going on with that. How are we treating it? So again, we're addressing the impairments. We've identified they have hypotonia. So what are we doing? We're going to do functional strengthening exercises to promote gross functional movements, like squats, are like hinging to pick things up off the floor, or pressing the arms overhead, like things that people do all the time. Push a door open, pull something towards you, lift your arms up. Like we're doing all of these like general strengthening exercises with these patients to help them out. And remember, it's going to be a kid, so they're going to learn through play. So they're going to practice and strengthen themselves through play. So we got to make it fun. Squats and stuff like that. I don't know. Leapfrog tends to be fun for those kids or something like that, just to kind of work on our strength and power. If you give a kid bicep curls, they're going to be like, this is stupid after like 2 reps and walk away. Like, don't treat a kid the same way you treat an adult. Honestly, some adults get bored with that too. Stabilization exercises are going to be key to help with the instability in the joints, to help with some proprioceptive feedback. So any sort of proprioceptive exercises are going to be awesome. Balance exercises are going to be awesome. A lot of I've seen the answer on the scoreboard was one that's like bounce the kid on your leg, bounce the kid on a ball kind of thing. That's all going to be fine. Again, avoid the somersaults. If you want to kill a kid with Down syndrome, have them do some somersaults. That's going to be great. Your license is going to love that. Don't do that. Yeah, somersaults, that's what's going to cause that internal decapitation. So we don't want that. And these individuals also have a shorter neck. So it's going to be harder for them to be able to control their neck as well. Parent caregiver education is going to be very key. Proper handling and positioning, especially if it's like a baby, they're low floppy tone. Make sure you got to hold their neck and stuff like that. And then proper positioning to like, have the kid avoid doing the W sit and stuff like that, making sure, because that's excessive internal rotation. Encourage parents to like have the kid move as much as possible, have them play as much as possible to keep them out of that sedentary lifestyle. You will be probably co-treating this individual with an occupational therapist, because occupational therapists, like they run the pediatric neuro world. They are like the #1 peeps in pediatric neuro. Like they do all the things and we love them and we salute them, bow down to our occupational therapy friends. Our speech friends are also going to be helping because of that protruding tongue and difficulty with controlling the muscles due to hypotonia. They're going to be involved with helping with speech, and then pediatricians are going to be overseeing all of this. You're going to have to avoid compensatory strategies with these individuals as much as possible. You want them to be moving as normal as possible. You want them to be doing the functional movements as much as possible. You don't want to be allowing them to, like, if they're walking in a way that's like not efficient, you don't want them like shuffling. Like you want them actually like using their gait properly to make sure that we're maintaining as much strength as possible, because those compensatory strategies will just end up leading to atrophy of the muscles, and you don't want a muscle that's already hypotonic to atrophy, because that's just going to make it worse. So don't do that. Keywords we're going to see for these individuals would be hypotonia. We'll see atlantoaxial instability, our ligamentous laxity going on, which can cause that atlantoaxial instability. Trisomy 21, anything with chromosome 21 is going to be a keyword for Down syndrome. Any sort of facial abnormalities as well. So all of the almond eyes, the abnormal ears, the flattened nasal bridge, the slanted eyes, it's all going to be in that. And then they're going to say like a developmental or an intellectual delay. That is how they will refer to the individual when it comes to their mental status. So let's get into the sample question. A 7-year-old child with Down syndrome is being treated concurrently with occupational therapy in an outpatient facility. Which of the following interventions would be most appropriate for the physical therapist assistant to perform with this patient? 1, somersaults on a trampoline. 2, stretching exercises by playing Twister. 3, freeze tag with 5 squats to unfreeze self. Or 4, coloring while sitting in a W sit on the floor. So I'll give you guys a second to think about that. All right, guys, so the answer is going to be freeze tag with 5 squats to unfreeze self. So again, big thing that we're going to be working on with this patient is going to be our functional strengthening stability movements. Being on a trampoline isn't bad. That would be helpful for some stability because of the uneven surface and everything. But somersaults, we already said, somersaults are the absolute worst thing. If they have a question that say, what's the worst thing to do with this patient, is going to be somersaults. If it's asking what's the most appropriate, it's definitely not going to be somersaults. Somersaults are bad. No somersaults. No rolling. Bad. Forward rolls. They will put this as a forward roll on the exam. If they don't want to say somersault, they're like, let's do a forward roll. That's essentially what it is. You roll on the floor, woo, roll forward. Yeah, for people who maybe English isn't your first language, you're like, what's that word? No forward rolls, like rolling onto your head. Stretching exercises by playing Twister. So it's gonna be incorrect because we have super ligamentous laxity going on. Our joints are already loosey-goosey. Our legs and our muscles are loosey-goosey. We don't need to stretch anymore. We need less stretchy, more stabilizing. So my one professor always says, do you need WD-40 or do you need duct tape? WD-40 would be everything's creaky and doesn't move. We need to loosen it up. Our duct tape is for our ones that are already super loosey-goosey and we need to keep them from falling apart. So we want to put duct tape. This is the duct tape thing. So strengthening and stability is key. So that freeze tag, it's a good game. Kids love it. It's like, oh, you're frozen. Do 5 squats to unfreeze yourself. With like 1, 2, 3, 4. Oh man, now you're after me again. Like that's what you're going to do. Because that's a strengthening exercise. We're like moving around. We're like playing and stuff like that. It's a functional exercise. We're all good. We're doing all functional strengthening stuff. Coloring while in the W sit. So coloring would be more that fine motor skill and everything. Maybe that would be better for our occupational therapists to take over, especially with like writing and stuff like that. That's more of their scope of practice. And then sitting W sit is just like absolutely not. No, because that's going to, we need to have them doing the crisscross applesauce. We're not going to be doing our W sitting. That's not going to be good for the hips. All right, guys, I hope that this was helpful in helping you guys understand Down syndrome. If you have any questions, let me know, and I will see y'all in the next one. Take care.